Hi, my name is Jennifer Woodall. I am a nursing student at FSCJ. Today I will be doing medication administration via primary infusion. First I will check the MAR, and the doctor has ordered Flagyl. It's going to be given 62.5 milligrams per milliliter through IV, infused over 1 hour. I would check the medication against the MAR, check the expiration date. I would check the patient's lab values and allergies. I would read the drug card, check the drug, and it's a antibiotic. It's given for intestinal infections usually. It can be given 500 milligrams per 100 milliliters over anywhere from 30 minutes to a half hour. I would check for signs and symptoms of adverse reactions, contraindications, and nursing interventions. Okay, so first I'm going to draw out my meds. So I would do hand hygiene. I'm going to get an alcohol swab, clean the top of my bottle. I'm going to draw up 1 milliliter of air. I'm going to inject the air into the bottle. And I'm going to draw my med, 1 milliliter of Flagyl. Recap my med, or my needle. Okay, and then I'm going to add it to the mini bag. Discard this in the sharps container. Okay, then I'm going to mix the bag of medication to get it all mixed around. I'm going to label the bag, and I will put the patient's name, the drug, the amount, the start time, and the date, and my initials. Okay, then I'm going to attach the bag to the tubing. I'm going to spike it and shake it up. Okay, and then I'm going to hang it and get ready to prime it. Okay, I'm going to unclamp all my things. Okay, squeeze the tube. Okay, and it is primed. I'm going to label the tubing. And this will have my name, or my initials and the time and date. And I will put that on the tube. Okay, now I'm ready to go into the patient's room. I'm going to do hand hygiene, knock on the door. I'm going to identify the client with his name and date of birth and his wristband. I'm going to explain the procedure to the client, tell him he's getting an IV. I'm going to double check again for any more allergies. And now I can do hand hygiene again, put on my gloves. Okay, I'm going to check the IV site and look for patency, look for any infiltration or phlebitis. And then I'm going to clean the site and start my ASASH method. So I'm going to clean the tubey thing. Then I have a pre-filled syringe. I'm going to put in 3 milliliters. I'm going to connect my tubing. First I'm going to aspirate. Oh, I'm going to unclamp my syringe. Aspirate. And I'm going to do the push stop for 3 milliliters, and while still pushing, I will apply positive pressure and disconnect. Okay, now I can connect my primary tubing. So I'm going to bring that down. I'm going to swab this with alcohol. Okay, I'm going to swab this one again, just for safety. Okay, connect it. Okay, I'm going to connect it. Open my clamps. Okay, and then wait for 17 drops. That's how many drops per minute we're going to have, so I would time it. So I've got the 17 drops now. Okay, so then at this point I would let it hang and run its course over the hour. I would come back throughout the hour, observe the infusion, make sure there's no infiltration or phlebitis. After that hour is over, I would come back, do hand hygiene, put on gloves again. I would look for any signs and symptoms of a medication reaction or IV infiltration, phlebitis. I would disconnect the tubing, or I would clamp off, disconnect the tubing, clamp all of my tubing off. Okay. Hang that. If it was an older IV, I would apply a new alligator clamp. I would alcohol my tubing again. Okay. And then I have another 3 milliliters in a prepared syringe to flush. Going to aspirate to see show of blood. Of course, this is unclamped. Then push stop. On my last one, apply positive pressure. Okay, sometimes we would flush with heparin if the doctor had ordered it, but in this case he did not, so we are not going to flush with heparin. Make sure that everything is in my sharps. Make sure everything's clamped off. I can remove my gloves now. I would monitor for edema, pain, tenderness, redness, allergies, adverse reactions. After that, the procedure's over, so I would leave the room and I would document the time and date, the drug, the dose, the route, the condition of the IV site, the volume of fluid on the MAR, and the input and output, and that is it.